MRD is becoming an important endpoint in myeloma. Number of studies have established that patients who achieved MRD negativity have better outcome, both progression-free survival and overall survival. We had done a meta-analysis of 13 different studies and showed clearly that all 13 studies showed that those who are MRD negative have a better outcome. So MRD is becoming an important surrogate for predicting PFS and even OS. And it's becoming almost a standard of care in how we monitor the patient, and it's beginning to also affect how we decide the treatment. So the questions would be, one of our studies showed that if patients get MRD negativity, doesn't matter what method was used, whether the patient got transplant or no transplant, their outcome is same. So what it means is that if somebody gets MRD negativity with induction therapy, then now we can do study to see if transplant is needed. If you get MRD negativity, do you need maintenance? Or how long you need maintenance? And those are important questions. Consolidation, similar issue. So now we are beginning to use MRD to even guide our treatment, more importantly do studies that will inform how to decide treatment based on MRD.